el tamaño y el calibre de los capilares y la relación arterio-venosa in vivo en los capilares.
Dr. Brückel from the University of Cologne was the one who in vivo was able to see the filling and the emptying of the capillaries, the size and the caliber of them, and the relation from arterial venosus in vivo. That was demonstrated by Brückel.
Y pudieron ver que en los campos interferentes se alteraba la vasomoción, o sea, la velocidad con que pasa la sangre por el capilar, la velocidad de traspaso de los nutrientes y de los desechos por dentro y por fuera del capilar, que llegaban a producirse verdaderas hemorragias, o sea, hablábamos del estancamiento, entonces se producían hemorragias del tejido, el color de base del tejido se alteraba, los eritrocitos empezaban a sufrir cambios y empezaban los eritrocitos a pegarse unos contra otros formando verdaderos troncos y emplastos de eritrocito, afectando tremendamente la circulación microscópica capilar.
Through this capillary microscopy that Brückel came up with, they were able to see how under the stress of a field of disturbance, the vasomotoric conditions changed. The speed in the one this flowing was supposed to flow physiologically was reduced, causing congestion and stasis. The velocity of interchange of nutrients and of trash, because they bring nutrients and take away, as we saw it yesterday, the smaller particles of the detritus, how that interchange was reduced. They found whole areas under hemorrhage, tisular hemorrhage. The basic color was changed and the erythrocytes started becoming fatter and fatter. And you had what they call an aggregation of the erythrocytes. They started to form colonies, like if they were just sticking together with some glue and forming blocks of erythrocytes.
Entonces, Berger en el Boltzmann Institute demuestra que el campo interferente definitivamente producía una disociada coordinación vegetativa en la periferia y que esto podía medirse por parámetros de iones, por colesterol en los cuerpos proteicos y en los glóbulos rojos.
Dr. Berger from the Ludwig Boltzmann Institute in Vienna was the one who started demonstrating that the ionic parameters were changed again under the influence of a permanent field of disturbance. They found cholesterol in excess and proteic contents that was way beyond normal standards.
Miremos ahora ya qué podemos hacer desde el punto de vista terapéutico en este problema.
So what can we do from a therapeutic point of view? As we saw it before, that there are two queens to help this part from a therapeutic point of view.
Esto se ha movido, no hay cómo arreglarlo. Bueno, la terapia básica sería la eliminación de las sobrecargas, hacer un análisis en la historia, eliminando todas las sobrecargas que haya y la reactivación del sistema por bioestimulación.
This is not the projection, this is just the picture itself. But what would be the basic approach to this here? First of all, after we have done a thorough clinical analysis of the patient, clinical history, we have to eliminate most, or if possible, all of the excesses of the surcharges that the patient is carrying along with him. Many of the fixed costs that he is still suffering, that he was able to carry with him 20 years before, because his budget was still sufficient. Now his energy, his chi budget is not sufficient to carry those fixed costs anymore, and those fixed costs have to be eliminated. And secondly, reactivating the system via biostimuli.
Estímulos inespecíficos que los demos con intensidad adecuada y repetición adecuada van llevando a una reacción de recuperación al sistema. Entonces, terapia neural, acupuntura, hidroterapia, masaje, homeopatía, dieta, todos esos estímulos que vayamos dando en la intensidad y repetición, porque cuidado, si yo le hago terapia neural hoy a un paciente y no le doy tiempo a que el sistema procese esa información y al otro día vuelvo y le meto terapia neural, le hago daño. Entonces hay que ir viendo la respuesta del paciente, cómo va reaccionando para ir dando estos estímulos inespecíficos.
The non-specific or inspecific stimuli we give have to be in the intensity and in the chronology that has to be adequate, otherwise we produce a negative reaction, because if we hit a patient today with neurotherapy and we don't allow the body to digest that neo information that we're supplying the patient with, you know, and we go ahead again tomorrow and here he comes again with his neurotherapy, we might cause an excess in this patient and that will be harmful. We have to allow him to digest, to process that new relearning that we're trying to give him. And this can be done specifically in intensity and in repetition, inadequate repetition to produce a positive reaction. That can be done with neurotherapy, with acupuncture, hydrotherapy, massage, with the cocktail on the left side, with all those measures that are able to produce an increase of the non-specific response abilities, of the utilization of the rights of the body, like excretion, reaction, etc.
Entonces miremos cómo pudieron ser demostrados claramente los efectos de la terapia neural sobre el campo interferente.
How were the effects of neurotherapy on the interference field? How were they demonstrated?
Cross, por ejemplo, demostró mediante oscilogramas que una vez llegábamos al campo interferente y le poníamos nuestra terapia neural, se producía una normalización de las reacciones vasomotoras alteradas. O sea, pudieron ver que esos vasos sanguíneos que estaban funcionando inadecuadamente los medían por un oscilograma y veían que al bloquear, al instante de trabajar sobre el campo interferente, empezaba a regularse el trabajo vasomotor.
Through the oscillogram, Gross was able to show us how if we injected onto the field of disturbance, there was a normalization of the vasomotoric reactions that had been altered. What does it mean? That those blood vessels that were enlarged, that were reduced and didn't allow a normal flowing speed of the blood, as we said before, came to a normal flowing into a normal size once we deposited the neurotherapeutic into the field of disturbance.
Por su parte, Schwann y Bergsman, mediante cámara infrarroja, pudieron objetivizar la normalización de la circulación periférica. O sea, si tenían un campo interferente produciéndome en la cámara infrarroja una alteración, cuando pullaban, por decir algo, las amígdalas, automáticamente esta interferencia en la circulación desaparecía.
Otto Bergsman and Schwamm demonstrated using the infrared analysis how the circulation, the peripheric circulation, normalized itself from a thermic point of view if we eliminated or disconnected the field of disturbance. Let's say if they had a concentration of heat, let's say at this level here, and it was believed that the field of disturbance responsible for that concentration were the tonsils, the sniper that was shooting at this pulmonary level, to give an example. Once the field of disturbance, tonsils, were eliminated, were injected with the neurotherapeuticum, how this congregation or concentration of heat disappeared, that is, how the peripheric circulation was normalized.
Gross Bergman también pudo, habíamos dicho que cuando había un campo interferente, había distintos hemogramas entre un lado y otro lado del cuerpo. Él pudo ver que al trabajar el campo interferente se normalizaba la diferencia leucocitaria entre ambos hemicuerpos.
Another thing that was shown by Otto Bergman, as we said before, we might have different hemograms on either side of the body. Bergman was able to demonstrate that after eliminating the field of disturbance, this hemogrammic asymmetry was normalized. That is, on both sides you were able to obtain equal or hemograms.
How long does it take to normalize?
¿Cuánto tiempo se demora en la normalización de eso?
Depende de la intensidad y de lo severo del campo, pero podía oscilar entre 5 minutos y 2 horas.
It depends also on the three factors that we mentioned before: the intensity, the duration the body has been exposed to that field of disturbance, and the starting point. But in his research, it went from 5 minutes to 2 hours.
Mediante el test de Altimet y la iodometría, Fischinger y Kellner demostraron que al hacer la terapia neural sobre el campo interferente se corregían los problemas a nivel del oxígeno. Había una normalización del gasto de oxígeno y se utilizaba simétricamente por todos los tejidos.
Another thing, through the LPMET test and the iodometric means, they found out that after injecting the field of disturbance, they were able to normalize the utilization of oxygen, and the oxygen was utilized symmetrically, that is, in adequate proportions by every part of the tissue.
Fleischhacker y Stacher y colaboradores, nuevamente en otra forma de experimento, demostraron que el hemograma en general, que podía estar alterado, se iba hacia la norma.
Fleischhacker, Stacher, and others, with other types of research, demonstrated how the hemogram, which was altered before the field of disturbance was disconnected, came to a normal range.
Fischinger y Kellner demostraron la normalización de la química sanguínea. Ya habíamos dicho que el campo interferente estaba alterando la utilización de sodio, de calcio y los electrolitos básicos del sistema de Fischinger. Estos electrolitos se normalizaban, esta utilización de sodio y calcio se normalizaba cuando desconectábamos el campo interferente.
Another interesting thing that was also found by Fischinger and Kellner was that the blood chemistry, that is the utilization of calcium, sodium, and electrolytes, which was out of balance and disrupted and irregular while being exposed to the permanent interfering emission of the field of disturbance, was normalized after a given field of disturbance was eliminated.
Scholler y Maresch muestran la normalización de las diferencias de potencial y resistencias en la piel. Ya habíamos visto cómo cicatrices o campos de interferencia podían producir cambios en la resistencia eléctrica de la piel. Desconectado el campo de interferencia, se producía una normalización a este nivel.
Scholler and Maresch were the ones that dedicated their efforts, their research efforts, to the skin, and they showed how the elimination of the field of disturbance brought with it a normalization of the differential potential and resistance at the skin level. We had seen before how a field of disturbance might interrupt the normal resistance and transmission of the skin, and how once the field of disturbance is interrupted, we have a normal sinus wave again.
What did they use? What technology did they use?
Injecting procaine or
How did they find out? With thermography? With what?
¿Cómo encontraron esos dos mares?
No, por medición de pasos de corriente entre una área y otra.
Just testing the transit of current from one part of a scar, let's say, to the other part of the scar.
Algo supremamente interesante fue demostrar cómo se normalizaba la curva de reacción vegetativa. Recordémonos que el paciente podía estar bloqueado en shock o en contrashock o en parálisis de regulación. Cuando se desconectaba el campo interferente mediante mediciones de índice RC o biometría, Krakmar y Rini demostraron que se restablecía la curva de respuesta vegetativa del paciente.
One of the most interesting things that was demonstrated by Professor Rilling, especially, and Krakmar, was how the normal reactivity curves of the body were reestablished after a field of disturbance was eliminated. You remember that the normal reactivity of the body is under an aggression. You have a shock, then the next phase is a counter shock, and the next phase is the phase of accommodation, where the body sort of realigns itself again to be ready for the next wave. But under the presence of a field of disturbance, the phases might be stuck, and a given body might be stuck at a counter shock phase, or might be stuck at a shock phase, not allowing this phase of accommodation, which is the phase of tranquility, is the phase of returning to normality, not allowing it to happen. And that was normalized after the field of disturbance was eliminated.
Muy interesante, sobre todo esto para la gente que trabaja en terapia física, fue la demostración de Breuser y Kochnack, que demostraron cómo había desaparición de las reacciones segmentarias patológicas. Por ejemplo, una gelosa dolorosa en la nuca, por ejemplo, una contractura tremenda, desaparecía desconectado el campo interferente generalmente odontológico.
This is one of the interesting things for you guys who might work with physical therapy. These guys, Kutschau and Poisel, demonstrated that once and in this case it mostly was, once a dental field of disturbance was eliminated or removed, let's say a gelotic tissue, for example, here, suddenly disappeared on its own without doing anything to make it disappear. You just eliminated the source that was nourishing and maintaining it alive, and once you took away the source, it had to disappear on its own. I think you dentists might see it very often when you extract or eliminate or clean a dental foci, how things at distance, the patient says, my God, doc, I mean, the pain here and that or there is gone. The same reaction is what we're just mentioning right now.
Y lo para mí más interesante, porque con esto ese artículo se lo he metido en la boca a más de uno, es demostrar los trabajos de Koch, Bauer y Sieger, que demuestran los mismos resultados en vacas, en terneros, en perros. Por lo tanto, eso se lo metí por la boca a unos cuantos que me decían que la terapia neural y esto era pura sugestión.
And one of the things that was most satisfactory for myself, and I have allowed myself to take that article and just make some colleagues at the university swallow it, when they said that this is all just hocus pocus and they're just mental influence. Dr. Kohlbauer is a vet from near Vienna, and Sigurd is a German veterinary doctor. This guy has demonstrated that exactly the same effects are produced in animals. And we in Los Robles, with our tour and with my brother, at a given time in the last couple of years, about 10 years ago, we did it with cows. We used to have some Holstein cows at the farm, and we tried to do exactly the same injections. We made, Kohlbauer taught me how to do the Frankenhäuser injection in cows. And you'll be amazed the results that we were able to obtain. So it is no hocus pocus. I mean, it is not that you're influencing the patient. Animals react exactly the same way, and that has been sufficiently proven by Kottbauer and Siegert, and we have lived it with our own animals.
How long
For
was
the
the needle?
Frankenhäuser, it's a 50-centimeter needle.
Okay.
What do you say?
Hold
the
on a
animal?
little bit.
Pardon me?
No, I'm not buying
What
any.
do you say in the animal?
Well, we had a lot of, for example, the things we worked the most with were sterility, because you have a high production cow which doesn't calve every year. It's no business, you know. And many of them, when they don't have, when they have that problem, they're sold for meat 3 or 4 months after they have the chance of calving again. So it was a gynecological problem. It might be a scar, and in most cases it was the trauma of the last birth, you know. And then you had a long speculum with a flash lamp here, and through the speculum you went in there with a 50-centimeter long needle, and you made the Frankenhäuser exactly the same way that we do it in ladies. But we had a big question. That's what Kottbauer, I brought that question to Kottbauer 1 year after he taught me how to do the Frankenhäuser. I said, my God, Dr. Kottbauer, have you ever thought yourself standing in front of a cow sitting on a gynecological chair? He said, no, why do you ask? I said, my God. I said, because if we are injecting in ladies at 5 o'clock and at 7 o'clock, and the ladies are sitting like this here in front of you, the cow is standing like this here in front of you. So it's not 5 and 7, it's 2 and 10. He said, you're right. You're right. If you look at it this way, you have to turn it the other way around. And from that moment on, we started injecting the Frankenhäuser in our cows at 10, at 2, at 5, and at 7, just to play it safe, you know, with incredible results. I mean, we bought, I remember the last job we made is we bought 11 sterile Holstein cows that were about to be sold for meat. Young ones, they had had only 1 calf each. And we started treating them, you know, with neurotherapy. 2 of them died under our experiments, you know.
Along this line, are there any natives? Are there any natives down in Colombia or Peru that eat coca leaves as a dietary rejuvenator or you know, a health aid?
Coca leaves?
Yeah, I mean, make tea and drink it, or
Well, in Bolivia, they drink the coca leaf infusion for problems of the altitude. If anybody of you has been in La Paz, in Bolivia, the moment you arrive at the airport at 4,200 meters, that's how much it takes in feet. That's 12,000 feet. You know, you got all kinds of sensations here in your temples, and then you get an infusion of coca leaves, and that sort of calms you down. I don't know why that question came up, but
well, the question came up because I could see that people that were exposed to these plants with the same chemistry as protein would do that just naturally. They would figure it out and start to use them.
maybe the betel leaves in Sri Lanka and in the south part of India might do the same, you know. But this cows, anyhow, 9 out of the 11 we were able to bring to a normal reproductive phase again, you know. And when you buy something for $1 and you can sell it with its product for $20, it's quite a good business, you know. And it worked exactly the same way it works with a human patient, you know. I hear from other vet doctors that work with small animal practice. Our good friend Gloria Dodd learned a lot about it when she was in Colombia with us. And she had very big successes treating dogs, I mean pinchers and whatever, small animal practice, very successfully. So there is no argument that this doesn't work, that this only works with humans. You know, it works with animals very finely.
How do you get a cow that will still treat
Well, I mean, it's easier to hold, sometimes it's easier to hold the cow than to hold the lady. You know?
Yeah, 1,500-pound lady. Like,
How much do you inject the cow? How much protein?
Here, it's not the volume. It is not the volume that counts, it's the stimulus and the same couple of drops or cc that you use in a female, in a human female, you can use, or we use it with cows. I mean, we're not navigating it in huge doses, it's exactly the same amount.
Entonces podríamos ya como finalizar, ubicar el concepto de salud como un condensador estable de membrana, como una membrana celular polarizada o como una membrana celular hiperpolarizada gracias a nuestra terapia neural.
So now, after we have gone through all these exercises, we might change our concept of health towards these three statements. A stable membrane condensator is what we have when we have health. A polarized cellular membrane or a hyperpolarized cellular membrane, that is what happens when we inject our neural therapy, because at that very moment our initial condition goes from minus 70 millivolts all the way up to minus, or down, let's say, to minus 240 into a hyperpolarized condition. Once the anesthetizing effect starts diminishing, it comes back to a normal polarization level.
Y enfermedad sería una carga celular hipopolarizada, una célula despolarizada o transpolarizada.
And what would be the definition of health then, from that specific point of view? A cellular charge which is hypopolarized at plus 20, let's say, a depolarized cell or a transpolarized cell condition.
Y esta sí es la terapia neural que nos entregaron los hermanos Huneke, que dista mucho de ser una anestesia, como algunos creen. Después de que ya entregué todas estas cosas, mi padre, cuando hace una cirugía, le pone cocaína en todas las cicatrices a su paciente.
And this is the neural therapy as it was taught and as it was discovered by the Huneke brothers. And after I gave all this speech and I collected all this information, my father, who is a surgeon, now every time before he starts closing, he injects procaine into the tissue. Thank you very much.
Alberto, let's go, we'll go in right into the rest of the head video, and then we'll do a demonstration.
Okay.
Spinopalatine ganglion, who wants to be the subject?
you win by default, Ed.
Well, well, all right. Nobody wants that one, I guess. But we can do crown of thorns, and we got a couple of volunteers, and then maybe we have a patient coming on Sunday that wants a sphenopalatine ganglion, so we'll see it done extra orally. Okay? I think it can be done orally too, but so let's go. Here we go.
Okay, this is the
We
Francis
gotta
Cross.
turn up the volume. Somebody want to turn the volume up over on that one?
Außer bei der Abnehmen sind wir keine Qualen, sondern initiieren an entsprechenden Stellen. Der Vorteil liegt neben der größten Streubreite in einer längeren Wirkung.
One of the things that we have to count on when we use procaine, be it in the face, be it in the joints as we saw it yesterday, is the importance of the diffusion. If we put those points that we saw before on the skull, the Francis crown, as Franz calls it, let's use our thumbs, and then after we make those little wheels, press on them and help diffuse a little bit more. The same happens with this injection that we make on the back of the skull.
Schnittpunkt der Lambda-Naht mit der Mittellinie. Der zweite am Schnittpunkt der Medianlinie mit der
Along the
Unterrand.
lambdoid suture,
Angezeigt sind diese Injektionen von je 1 Milliliter unter die Galea, wieder mit der 20er Nadel, bei Hinterhauptskopfschmerz, Sinusitis,
occipital headaches,
Konzentrationsschwäche,
sinus problems,
und im Klimax. Der Nervus
climacterium
occidentalis
problems, and
ein Ast des
disturbances in your sleep. You're going to be stimulating all the blood irrigation in that
Die
area.
Nervendurchtrittsstelle ist druckempfindlich.
And remember that if you're stimulating the blood irrigation, you're stimulating the oxygenation. And there is no part of the body that can be normal 100% if you are missing oxygen. Those 2 points, the occipital points, in most of the people that have gone through a lot of stress, have had a bad night. You palpate them in the back and they hurt. They're painful.
Linie beider Ohrmuschelmitten aufgefunden. Eine Irritation dieses Hinterhauptnerven ist oft die Ursache für Okzipitalneuralgien, Nackenschmerz und Nackensteife sowie allgemeinen Kopfschmerz.
And you can imagine that if you have an irritation of the nerve exits that you have at these 2 occipital points, you might have headaches that radiate upwards and that radiate downwards, and you might have pains in your shoulder region, and all being originated because of an inflammatory condition in this nervous sections here.
Infiltration von je 2 Milliliter des Neuraltherapeutikums an die Austrittsstellen, wieder mit der 20er Nadel, überraschende Erfolge. Verstärkt wird.
Your finger plays a very important role here because you glide along the head and you ask with your finger, does it hurt here? And whenever the patient says, yes, there is, leave your finger there and go along your fingernail with the needle and inject where, because it's his personal point of pain. Go ahead.
Indikationsstellung durch die occipitale Abriegelung.
You can make a blockade of all this here, just infiltrating all this here.
Infiltration der Verbindungslinie beider Occipitalis Austrittsstellen mit der 20er Nadel.
And after
Dazu
that,
5 bis 8 Milliliter des
you push
Neuraltherapeutikums
it with your thumb and you diffuse it a little bit more.
Schlafstörungen ist die subkutane Injektion von je 1 Milliliter beiderseits in das Grübchen zwischen dem Hinterrand des Sternocleidomastoideus und dem Unterrand des Occiputs.
Bei Frontkopfschmerz, der Sinusitis frontalis, dem Schnupfen und auch bei der Anosmie hat sich die Injektion an die 3 Punkte des magischen Dreiecks bewährt.
In cases of chronic sinusitis, anosmia, and frontal headaches, the injection into what the Chinese call the magic triangle has been very positive. They can do it with acupuncture needles, or you can help yourself with an inspecificum called procaine or xylocaine.
Bei jeweils 0,5 Milliliter mit der 20er Nadel in die Haut injiziert.
Der Nervus supraorbitalis, ein Ast des ersten Trigeminusastes, tritt durch das Foramen supraorbitale aus. Diese Stelle liegt im medialen Drittel des knöchernen Oberrandes der Orbita und ist druckempfindlich. An dieser Stelle wird mit der 20er Nadel eine Quaddel gesetzt und dann in einem Winkel von 45 Grad nach lateral eingestochen und ein halber Milliliter deponiert. Meistens genügt aber die subkutane Injektion an beiden Seiten. Die Indikation stellt vor allem die Frontneuralgie, die Neuralgie des ersten Trigeminusastes und die Sinusitis frontalis.
This exit of the first branch of the trigeminus which is the supraorbital foramen, is indicated in frontal headaches, in sinus congestions, and also in gallbladder problems.
Can it be useful in diabetes?
Diabetes? Well, I wouldn't know. I haven't heard that. But I have seen that a lot of colics, gallbladder colics, in their acute phase, injecting this gallbladder point, or even shiatsu, just touching it, produces a calming down of the colic instantly. But I haven't heard that indication in
The German
diabetes.
doctor told me about it. He said he's had benefit in diabetes by using that.
Well, another indication is good.
An der Nervus infraorbitalis, einem Ast des zweiten Trigeminus, ist die percutane Methode vorzuziehen.
You can take the second branch, the second foramen of the exit of the second branch of the nerve, of the trigeminal nerve. You just palpate it. Normally it is also painful because if you palpate it, you just squeeze it against this bone structure and it hurts. There again, you don't have to go into the foramen itself. You deposit the procaine and through pressure you diffuse it in that area, and then the nerve ending or beginning or branch part or whatever carries the information with it.
Der liegt am Unterrand des Arcus zygomaticus, circa ein Querfinger lateral vom Nasenflügel. Mit der kleinen Nadel sticht man einen Querfinger kaudal der getasteten Austrittsstelle und einen halben Zentimeter lateral vom Nasenflügel.
Maxillary sinus congestion. Stomach problems, because the maxillary sinuses have to do with the stomach. The ones here are also for andro or gynecological problems, because this is the bladder meridian.
Zentimeter Tiefe dringt man in das Foramen ein, wo ein halber Milliliter injiziert wird. Die Indikationen für diesen Eingriff sind die Sinusitis maxillaris, die Neuralgie des zweiten Trigeminusastes, diffuse Schmerzen im Oberkieferbereich und die Gesichtsneuralgie. In diesem Punkt, der einen halben Querfinger oberhalb der Jochbeinbogenmitte liegt, wird mit der kleinen Kanüle auf beiden Seiten eine Hautquaddel gesetzt. Damit erzielt man Erfolge bei der Migräne, dem allgemeinen Kopfschmerz, sowie bei Durchblutungsstörungen im Kopf und bei Wechselbeschwerden.
This point that you're just looking at is a very good point in climacteric headaches, in migraines, and you just palpate it, just divide this transit distance in half, and exactly in the middle, just palpate it, and it's also a little painful. There you make a papule or a wheel of half a cc, and also through pressure you help diffuse it. It is the measurement point of the optic nerve in electronic punch.
Die als temporale Abwicklung oder transtemporale Block zu bezeichnen ist. Technisch bietet sie zwei Möglichkeiten an. Die eine
You can use the same injection point to do a transtemporal blockade, if you have those temporal headaches on this side. But again, never forget what kind of meridians you have running along this side, and you know that the gallbladder is playing a very important role on this side. But you can do as much as you want here. If it is the gallbladder that is acting as field of disturbance and sending the disturbance emitting information via the meridians, you can do as much neural therapy as you want here. If you don't take care of your gallbladder, and that's where the circuits and the teeth and the odontons play a very important role, you're just pumping procaine, and working locally. And yes, and it'll go away for 20 minutes while the anesthetizing effects last, and then it comes back. And then you're doing allopathic medicine with non-allopathic means.
Gebrochenen Punkt aus oder auch mittels mehrerer Einstiche zum Augenwinkel und zum Ohr zu infiltriert. Bei der anderen sticht man mit der 6 cm langen Nadel lateral vom äußeren Augenwinkel ein und geht spritzend oberhalb des Jochbeins bis zum Ohrmuschelansatz
You go
vor.
very
Dazu
superficially
benötigt
from
man
that
3 bis
point towards the ear, just depositing 1 or 2 cc, making this transtemporal blockade.
Indiziert ist dieser Block bei schweren Kopfschmerzen, zentralen
Temporal
Durchblutungsstörungen,
pains,
dem
central irrigation
Schwindel
problems.
und auch bei Beschwerden im Senium.
Durch eine
That
retrovulväre
climaterium
Injektion
is
wird
also
das Ganglion ciliare beeinflusst. Der Kopf des Patienten wird fixiert und der Bulbus vorsichtig vom Orbiterboden abgedrückt.
The ciliary ganglion injection is one of the injections that I would recommend to leave it for the more experienced. It is a very common injection for the eye specialist because he does it on an everyday basis. But for the ones that are just starting with neurotherapy, it's one of the injections I would suggest you really gain more confidence in yourself and training, and then you can go ahead and do it.
5 cm langen dünneren Nadel wird das Unterlid durchstochen, am linken Auge bei 5 Uhr, am rechten bei 7 Uhr.
On the left eye at 5 o'clock, on the right eye at 7 o'clock.
Tief eingeführt und nach Aspiration werden 2 Milliliter injiziert. Sie erreichen umflutend das Ganglion. Eine Verletzung des
You are
Bulbus ist
just
auf alle Fälle zu
depositing the
vermeiden,
procaine
während
just
dann durch
in
das
front
Auftreten
of
des
the
Hämatom
ciliary
oder ein
ganglion.
temporäres Schielen bedeutungslos sind.
It's
Die
going
Indika-
to strengthen all the posterior components of the eye structure. It's irrigating,
Alle entzündlichen und
It's
chronischen
bringing
Augenerkrankungen,
oxygen
die Iritis, Iridozyklititis,
iritis,
etc.
iridocyclitis.
Darüber hinaus kann man damit auch das Auge als Störfeld ausschalten.
And
Wenn es sich an
remember,
dieser Stelle nach
the eye itself might turn as an eye into a field of disturbance because any part of this body, any square inch of the body might turn into a field of disturbance if at a given moment it was, let's say, under an inflammatory condition.
Verletzungen oder Operationen etablieren kann.
Da dieser Eingriff den Geübten vorbehalten ist, empfehle ich zur Behandlung des Auges einen Punkt aus der Akupunktur. Die Wirkung damit ist so gut, dass man in vielen Fällen auf die diffizile Injektion an das Ganglion verzichten kann.
He says that since this is an injection that is difficult to perform, he recommends one of the points of acupuncture, and you just deposit a wheel there. This is much easier. There is no way you can do any harm with this one. And in most instances, it has so much effect that you don't even need to perform the ciliary ganglion, which is tricky.
Blasenpunkt, der im Winkel zwischen Orbitalbogen und Jochbein liegt und der in
It's the
enger
UV
Beziehung zum
point.
Augeninneren steht. Mit der 20er Kanüle wird an der geschilderten Stelle beiderseits eine Quaddel gesetzt und dazu 1 Milliliter in die Vene injiziert.
You will find out that along the pictures of the movie that we're going to be seeing these days, in many of the injections that you do in this part of the body, he accompanies the injection with 1 cc intravenous, and as soon as he's getting out of the vein, he deposits another 1 or 2 drops paravenous next to the vein. What is he trying to do with that? He is trying to energize via the vein all the upper quadrant. And with the paravenous drops, he is using a stimulus for the brain and for this quadrant through the adventitia tissue and that para tissue that we have along the vein structures.
Die entzündlichen Augenerkrankungen erfordern in besonderem Maße eine gründliche und intensive Störfeldsuche, auf alle Fälle aber die radikale odontogene Sanierung.
Eye problems in general, besides having to go to the eye specialist at a given moment, require of a thorough and serious dental examination and cleaning.
Möchte ich einen Grundsatz der Neuraltherapie in Erinnerung rufen. Verläuft eine lokale Behandlung erfolglos oder verschlimmert sich das Leiden daraufhin, so denken Sie immer daran, dass ein Störfeld die Ursache sein wird.
Here he is just repeating, one of the basic pillars or ground stones of neurotherapy, that if a local treatment once or twice or 3 times does not bring any kind of response with itself, it is not ethical to continue treating the same way that you have approached it. You have to go and look for your field of disturbance, for your sniper that might be the one that is shooting towards the place that you unsuccessfully were approaching.
Uhr als Störfeld ist in der Neuraltherapie einfach zu erfassen. Mit
The
24
ear structure, the ear organ as an organ might turn like any other part of the body into a field of disturbance. The elimination of the ear as field of disturbance is relatively easy. That is done with 2 points in the back, the mastoid process and the gate of the ear from the acupuncture point.
der Seite ein halber Milliliter subkutan injiziert und dazu 1 Milliliter intravenös gegeben. Es ist vorteilhaft, dazu noch einen Punkt auf jeder Seite zu quaddeln, der im Grübchen zwischen Tragus und oberem Ohrmuschelansatz liegt.
Subcutaneous. Just go subcutaneous and you make a little swelling, which is what we call the wheel or the papule or quarrel. Quarrel is journalish.
Zur Störfeldausschaltung müssen selbstverständlich auch etwaige Narben nach Operationen am Ohr infiltriert
In many
werden.
instances, scars that you might have behind the ear of any ear surgeries and the earrings piercing here, those are potential field of disturbance. That's a scar as much as your navel is your first scar.
Facelift scars.
Oh yeah.
Trägerinnen von Ohrringen, weil dort öfters Entzündungen entstehen. Die Indikationen für diese Behandlung sind akute und chronische Otitis, Hörfehler und Ohrgeräusche sowie das Ohr als Störfeld.
Für die Nasennebenhöhlen ist diese Methode, was die Therapie und das Störfeldgeschehen betrifft, von großer Bedeutung.
For all the paranasal sinuses and the sinus condition as such, the treatment with neurotherapy is of uppermost most importance. And as Ed was saying before, facelifting scars, the ones that have undergone facelifting or any kind of other lifting, might know that some of those areas become numb. You can just pierce them and pinch them, and you don't feel anything else. If they are repolarized with neurotherapy before too much time elapses, because the prolonged exposure to that field of disturbance might be of incidence in the seriousness of the damage it causes. If you repolarize those lifting scars soon after the surgery, you might recoup the flowing of energy in that region, and those areas don't stay numb as it occurs many, many times.
Die Breite ist sehr groß und sie reicht von allen Formen der Sinusitiden, des Kopfschmerzes, der Gesichtsneuralgie und des Schwindels bis zur wichtigen Störfeldeliminierung. Bekannterweise ist in diesem Bereich sehr oft die Ursache für das Asthma bronchiale und die Trigeminusneuralgie zu finden. Von den neuraltherapeutischen Möglichkeiten der Einflussnahme auf die Nebenhöhle erwähne ich den Pantocain-Nasenspray und die Injektionen in die Austrittsstellen der supra- und infraorbitalnerven.
We saw just a couple of minutes before how many field of disturbances are located in the cephalic area. Dr. Ball used to talk about 70%. You saw this year in Arturo's test that it went up to 98%. Some others talk about 75%. Whatever it might be, it's a hell of a lot. I mean, let's say it would be 50-50, 50% here and 50% in the rest of the body. You still have a lot of areas to look for possible field of disturbances. exogenous, endogenous. So this indications in your head area where you have so many important organs and where you have that fuse box of the body, which is the mouth, where you have 32 different fuses, is very important. And for every kind of happening that might be unchained from the head, that 70 or 98 or 65 or 50% has to be taken very seriously if we want to disconnect fuses or reconnect fuses that might bring the healing to distant parts of the head.
Bringt die Behandlung über die Nasenmuscheln, bessere Injektionen des Ganglions Phenopalatinum und optimale die Akupunktur. Mit der Injektion in die mittlere und obere Nasenmuschel werden die Ausläufer des zweiten Trigeminusastes und der Nervi olfactorii erfasst.
The olfactoric nerves and the second branch of the trigeminus might be reached not only from the outside if we palpate them, but also via the nose. You know, it is a little unpleasant and you might have a massive hemorrhagia after that. But after that massive bleeding, the patient really feels absolutely decongested. That's one of the ways, of the old ways that the French brought into the neurotherapy on how to get to those two specific points.
Speculum wird die entsprechende Muschel eingestellt und mit langer, dünner Nadel 1 Milliliter infiltriert. Damit werden die Nebenhöhlen therapeutisch erfasst,
You are
aber
reaching the paranasal sinuses,
eliminiert.
Der
ethmoidal
neuralgische
cells, paranasal and ethmoidal cells.
Phenopalatinum ist indiziert bei der Sinusitis maxillaris,
That's the
bei
phenopalatinum for the
Gesichtsneuralgie,
maxillary
bei der Neuralgie
sinusitis.
des zweiten Trigeminusastes, bei Heuschnupfen und zum Ausschalten des Störfeldes Kieferhöhle.
Hay fever, and to eliminate the upper mandibular region as a field of disturbance, because as any other part of the body, this part, the maxillary part itself, might turn into a field of disturbance.
Erfolgt der Einstich mit der 6 cm langen Nadel knapp oberhalb der Jochbeinbogenmitte. Nach Durchstechen der Haut wird die Nadel schräg nach unten innen gewendet und in Richtung zum oberen Weisheitszahn der Gegenseite vorgeschoben.
For the injection
Nach
into
5
the
bis 6 cm
phenopalatinal
erreicht man
sinuses,
mit Knochenfühlung die Fossa pterygopalatina und
You're-
injiziert nach Aspirationsversuch
You're
3 bis
aiming-
5 Milliliter.
you're aiming at the opposite side where you have your wisdom teeth on the opposite side.
Den mäßigen Druckschmerz in den Zähnen des Oberkiefers. Wenn nicht intravasal injiziert wird, treten bei Einhalten dieser Technik keine Komplikationen auf, wenn man von einem möglichen, aber belanglosen Wangenhämatom absieht.
What can happen sometimes if you just touch a vascular structure in this area, you might have a superficial hematoma for a couple of days. So that's makeup.
Erfolge
Maybe
bei der Behandlung der Nasennebenhöhlen erzielen wir mit der
Would you repeat that?
it's a very superficial makeup. Here it might be jail, I don't know.
Die Kombination von 15 Stahlnadeln, 13 im Gesicht und 2 an den Handrücken, zusammen mit 2 Xylokain gedrängten Wattestäbchen als Naseneinlagen, hat sich bei unserer Arbeit optimal sowohl zur Therapie als auch zur Störfeldausschaltung bewährt.
In sinus congestions, using the Q-tips with procaine, and better with xylocaine 5% because you have a more intense concentration. The Q-tips into the nose as deep as you can get and leave them for 5 minutes there. That has helped a lot to decongest sinus congestive conditions.
Punkt in der Mitte der Nasenwurzel. Blase 1 und 2.
This is this combination with acupuncture needle that he uses, what he calls the acupuncture
Nase 5, Nase
treatment.
1, Dictam 19, der in Höhe der Nasenlöcher in der Nasenlabialfalte liegt, und der Dictam 4, der am Handrücken im proximalen Winkel zwischen Metacarpale 1 und 2 liegt.
Large intestine 4 and all those points along the face stomach, large intestine 20, stomach 19, the magic triangle, and on top of that, those Q-tips into the nose is a combination between acupuncture, between local therapy with those Q-tips, and large intestine 4 to tackle a severe sinus congestive condition.
Wenn alle Therapieversuche scheitern sollten, so ist unbedingt an eine Ursache im Zahlkieferbereich zu denken.
And don't forget that if your sinus problems do not respond to any kind of these approaches, look at your dentist.
Benötigt man wiederum die 6 cm Nahrung.
Because again, in most, and it means most of the sinus problems, the vicinity is, if not 100% responsible, at least co-responsible, and maybe a root canal treatment or the penetration of the sinus by some roots of a molar might be responsible for that condition.
In der Incisura mandibulae. Sie zu ertasten, öffnet und schließt der Patient den Mund. Knapp unterhalb der Jochbeinbogenmitte, 1 bis 1,5 cm medial vom Trabus, ist die Einstichstelle.
This is the
Der
semilunar
Patient lässt den Mund halb offen, die
ganglion of
Kanüle wird
Gasser.
senkrecht zur Haut eingeführt, bis nach 4 cm Knochenkontakt erreicht wird. Hierauf wird sie ein wenig zurückgezogen und in etwas dorsaler Richtung neuerlich vorgeschoben. Mit insgesamt 5 cm liegt sie vor dem Foramen ovale.
This is the gassary, or the semi-lunar gassary ganglion injection, which is also to interest all this lower part of the upper mandibular region with the sinuses that we have included in there. It's practiced, or it's carried out with a 3 to 4 centimeter long needle, thin needle, you don't need a thicker needle, and injecting in this direction. Depositing 3
4
to
bis 5
4
ml
cc.
deponiert. Die Nadel sitzt richtig, wenn Parästhesien im Unterkieferbereich und Zunge auftreten.
Since you have the flowing of the third branch of the trigeminal, which has its exit point here, you will find that once you have injected this gassary ganglion onto the gassary ganglion, the patient will very soon start feeling paresthetic sensations in the lower, or in the third trigeminal nerve branch,
Why so much 3 to 4 cm?
just to diffuse this area here. Depending on what kind of anesthesia you use. If you're using procaine 1%, and that is detoxified in the tissue itself because of the lack of components, in 20 minutes, 25 minutes, it's gone. If you're using xylocaine or any of the PAB added local anesthesia, that paresthesia might last 1.5 hours or 2 hours.
Des dritten Astes, wenn andere Methoden versagen und eventuell bei Kopfschmerzen unklarer Genese.
This is very much used in those trigeminal neuralgia which concentrate on the third branch, and it's also used in headaches of non-specific origin that you don't really know how to tackle. That might be one of the ways of seeing if that is the area which is acting as field disturbing and exteriorizing or manifesting itself as a non-specific headache.
Wouldn't that get all 3 branches? Wouldn't that get all 3 branches if you get into the Gasserian ganglion?
You don't go into the Gasserian ganglion, you go onto the ganglion. It's very difficult anatomically to go into it's a semi-lunar ganglion which is way in there, and you just get about 1/2 inch before it, and that's why you deposit 3 cc's there, so that via diffusion you're able to interest that ganglion too. You don't go into the ganglion.
Das, den auch seltene Störungen Parotis, soll nicht vergessen werden. Beim Mund des Erwachsenen werden durch Injektionen in diese Drüse die obligaten Entzündungen der Adnexe und des Hodens prompt zum Abklingen gebracht.
mumps is one of the problems that we can tackle with neurotherapy very easily. You will see the techniques here, and you can just avoid possible testicular or adnex consequences if you prevent under a mumps problem the proliferation of interfering information towards the andro or gynecological region with this type of injections.
Empfiehlt sich bei Mumps, diese Genitalorgane präventiv neuraltherapeutisch mit zu behandeln.
Die Technik ist einfach. Es wird an der
This is the technique, and he recommends that if it is a flourishing mumps, before anything could happen at the testicular level or at the gonads, to inject the gynecological or the andrological area too, and to do the intratesticular injection. It's unforgettable.
Any volunteers for that?
Any volunteers?
Die Donzillen sind auch ohne klinische oder anamnestische Hinweise immer als ein potenzielles Störfeld zur Herzsuche heranzuziehen. Das Gleiche gilt selbstverständlich für die Mandelnarben. Daher soll jeder neuraltherapeutisch Tätige ihre Ausschaltung beherrschen.
The parotids themselves, as any other part of the body, can turn independently into a field of disturbance. That's why during a parotitis, the repeated injections into that area will contribute to eliminating the possibility of those acting as a permanent field of disturbance. Though the fact that they were inflamed alone leaves the engram, and they have to be considered under any other disease as possible candidates to be again re-injected as a field of disturbance. Now he's starting to talk about the tonsils, and we all know from electroacupuncture, we all know from the Pishinger basic system how important the lymph is. Now maybe we have a better and clearer picture of it. The injection into the tonsils, onto the tonsil beds or tonsil scars is very important, because with that injection you are mobilizing 14 to 15 liters of lymph, and you know how important the mobilizations of those 14 to 15 liters are, because that's the janiting or janitor system of your whole Pishinger basic system.
Der chronischen Tonsillitis und bei Seitenstrangbeschwerden indiziert. Dazu möchte ich noch erwähnen, dass die Neigung zu Seitenstrangpharyngitiden bei Tonsillektomierten ebenso wie die chronische Tonsillitis fast immer durch pathologische Veränderungen im Zahn-Kieferbereich hervorgerufen wird.
This chronic tonsillitis or the chronic pharyngitis in tonsillectomized patients will always, in most of the cases, come from a mutation in the tissue at the scar level. So the intra-scar injection, and that scar looks brilliant. It looks like ¿cómo se dice, Nata? It's very glossy. Yeah.
Mother of pearl.
Like mother pearl. Yeah. You have to inject into the scar and break that scar tissue, because that scar tissue needs blood. And if you bring blood in there, you bring oxygen in there. And if oxygen is in there, it is repolarized again. And those lateral pharyngitis caused by that tension will very soon disappear. What we have done lately means for about 4 or 5 years, is we have been mixing with his blessing, as he mentioned it yesterday, last year here in the same room, we have been mixing our neurotherapeutic agent for this injection into the tonsils with lymphomyosod, which is a heal remedy, which makes part of the left side cocktail that we mentioned yesterday. Why? Because lymphomyosod is the fuel, in this case it is the specific fuel for that lymphatic management, which is here at the Waldeyer or tonsillar ring. So if you have a non-specific agent like procaine or xylocaine, which is going to activate all this management seat here, and you have at your disposal a more specific fuel for that specific area, the lymph area, the Waldeye's ring, the lymphatic ring, we have been mixing our procaine with lymphomiazole to do this tonsil bed injection with beautiful results.
Ab, dass vor einer beabsichtigten Mandelentfernung die radikale odontogene Sanierung durchgeführt werden soll. Dann erfolgt sich meistens die Ektomie, beziehungsweise kommt es zu keiner Seitenstrang-Irritation.
One of the things he's recommending is that before somebody undergoes tonsillectomy, and fortunately nowadays there is less knife happiness in that sense than there was before, you know. They were just cutting tonsils as if God had put them there for nothing. But he says, if you forget your odontons as field of disturbance, and you have them there with all kinds of metals, with root canal treatments, with rotten conditions, decay, etc., and you send a patient to his tonsillectomy surgery, you cannot expect that patient to have a good postoperative phase, because from the odontist you will have so many interfering messages being emitted to this area that his postoperative period is going to be just lousy. So before a patient is tonsillectomized, you better make sure from a biological point of view that his dental condition is okay.
What if you have an acute situation with the tonsil?
Oh yeah, you can. You don't inject into the tonsil. You, yeah. Here you have the tonsils. You know, they're still there. You inject here. This is the lower pole, and this is the upper pole. Let's say if you don't have the tonsils anymore, you have the scars. You go here, here, and you go right into the scar, because with the pressure of your liquid, you break that scar tissue. Breaking that scar tissue, you're bringing blood into it, and if you're bringing blood, you're bringing oxygen into it, and then this whole area will be flooded with blood and thus with oxygen again. That might hurt a couple of days, it's unpleasant, but if you know what you're mobilizing with this injection, you know, you take that for granted, and the patient will take that for granted too, you know, because you're mobilizing a proper flow of 14 to 15 liters of lymph.
With the lymphomiazole, how much do you use?
Normally when we do both poles at the same time. We take a 5 cc syringe and we put 2 cc's of siloneural or procaine or lidocaine, whatever, and 1 ampule of lymphomiazole, and we distribute it in the 2 poles. Next one. Next one, I mean.
Für die technische Durchführung hat sich die 6 cm lange und 0,5 mm starke Nadel bestens bewährt. Sehr geeignet, besonders für die noch Ungeübten, ist die Tonsillennadel nach Strumann. Bei ihr verhindert eine Arretierung in Form eines kleinen aufgelöteten Tellers ein zu tiefes Eindringen.
There are several ways to do the tonsillar bed or pole injection. We introduced, unfortunately, a period of time where it was done with the dental syringe with no possibilities of aspiration. We quit that because we didn't have any problem, but some of the people that learned it that way had a couple of problems. So you can use the Strumann needle, which has a protector at the tip, so you can go as deep as you want. Since it has a sort of a shield there, you cannot go any deeper. Or you use a 6 cc needle, since you are penetrating soft mucus only just about this much. You fix it with your finger on the teeth. Her patient can move as much as he wants, and the needle won't go in, will not be moving and can't go any longer.
Muss mittels einer Nackenstütze oder durch eine Hilfsperson fixiert werden. Der weit geöffnete Mund soll gut ausgeleuchtet sein. Die Zunge soll nicht herausgestreckt werden, sie wird mit dem Spatel leicht niedergedrückt. Auf jeder Seite wird unterhalb der Mandelpole einen halben Zentimeter tief submukös eingeschlossen und nach vorheriger Aspiration jeweils 1 Milliliter injiziert. Bei Tonsilektomierten wird nur in die Narbenmitte einen halben Zentimeter tief eingegangen und wieder nach Aspiration auf jeder Seite 1 Milliliter eingespritzt.
In tonsillectomized patients, or some patients have the tendency to vomit if they even brush their teeth, you know. In those patients, it's always a little bit more difficult. If you ask them to breathe a little faster, you know, they lose their concentration. Their mind doesn't concentrate on the stimulus to vomit. They concentrate on their breathing, and you can what is easier. He was just saying at this moment that in tonsillectomized patients, it must not be forgotten to inject right in the middle of the scar to break that scar tissue.
Die Aspirationsversuche werden deshalb betont, weil durch eine Injektion in ein hirnwärts ziehendes Gefäß zentrale Krampfzustände auftreten, die nur durch ein intravenös gegebenes Barbiturat, beispielsweise Bentotal, kupiert werden können.
He emphasizes that especially when you're beginning and after that too, if you're using, you inject in the tonsil bed, he always asks for the aspiration before injecting, because we are very much in the vicinity of vessels, of major vessels that go towards the brain, and the presence of procaine in those vessels going in direction to the brain might cause convulsions that can only be cut with a barbituric agent.
Kann es kommen, wenn in die Mandel injiziert wird und damit ein Tonsillarabszess auftritt. Des Öfteren bringt diese Mandelausschaltung nur einen Teilerfolg, und der Grund dafür ist meistens in einer Mitbeteiligung der Tonsilla pharyngea zu finden, die am Rachendach liegt und die in diesen Fällen ebenfalls ausgeschaltet werden muss.
In many instances, we don't obtain the result that we were expecting with the injection onto the palatine tonsils. That means that we have to orient our interest towards the pharyngeal tonsil, and look at this beauty here. That's his film of the pharyngeal tonsil, which is at the top, which has to be injected too.
Erfolgt wieder mit der 6 cm Nadel durch den weichen Gaumen. Und zwar etwas lateral der Mittellinie, knapp vor dem Übergang zum harten Gaumen.
Laterally from the middle line, in the transition point between the loose and the hard part of it, you go half a centimeter and you will have bone contact, and there you deposit 1 to 2 cc.
Now this is the sphenopalatine.
No, the sphenopalatine is from the outside. This is the Leger injection, the pharyngeal tonsil.
Oh, the one on the
Kommt es danach zu einem unbedeutenden Nasenblut.
Here again, with this injection, when you pull out the needle, you might find that the patient has a spontaneous nose bleeding, you know, which goes by in a couple of seconds without any problem.
Oberen Mandelpolis wird wieder mit der 6 cm Nadel in lateraler Richtung
The
zum
tonsilla tubaria, the tubal
20
tonsil,
cm tief eingestochen.
all those tonsils play in many instances as an orchestra. And if you might eliminate one of the tonsils as a possible field of disturbance, you might find out that the tubal or the pharyngeal tonsil might be still acting as disturbing agents.
Findet der Patient die Flüssigkeit im Ohr.
When you do the tubal tonsil injection, the patient has the sensation of having a waterfall in his ear.
Is that the Eustachian tube, that one?
Pardon me?
Was that the Eustachian tube, that one he did just then?
Yeah, that's right. And when you inject that, the tonsilla tubaria, the patient will feel the sensation of having a huge waterfall within his ear. And then you're right at the correct spot.
Did he depress the needle and bend it to get at the right angle?
Not for this one, and not for the
He put his finger on the
pharyngeal.
needle, though.
Pardon me?
He put his finger on the needle.
Like this here.
No, right on the needle itself.
Let's get it back.
Die Krankzustände auftreten, die nur durch ein intravenös gegebenes
weichen Gaumen. Und zwar etwas lateral
So this
der
one you mean?
Linie, knapp vor dem Übergang zum harten Gaumen. Die Nahrung wird in einem Winkel von 45 Grad nach kranial, circa 3 cm tief eingeführt, bis Knochenkontakt erfolgt.
This one, if the patient is lying back, can be done this way. Otherwise, you bend the needle in 45 degrees and you
Ähnlich
get
von der
exactly
Technik
to
her
the
ist
point
auch
you're
die
looking for.
Injektion in die Tuba Eustachii. 1 cm
Eustachian
kranial
tooth
des oberen
for tonsilla tubaria.
mit der 6 cm Nadel in lateraler Richtung zum äußeren Gehörgang 2 bis 3 cm tief eingestochen. Nach vorheriger Aspiration wird 1 Milliliter injiziert. Bei richtiger Lage empfindet der
Just
Patient
holding it, so if the patient moves, the needle won't go any deeper, so that he can do the aspiration with the other hand.
Ohr. Indiziert ist diese Behandlung beim akuten und chronischen Tubenkatarrh.
Der Zahnkieferbereich spielt im Herzstörfeldgeschehen eine große Rolle. Es ginge aber über den Rahmen dieser Ausführungen hinaus, alle Störfeldmöglichkeiten dieser Region aufzuzählen.
We don't need to
Die
mention
Mitarbeit des
how important the odonton, the oral cavity, is in all the focal happening of the head. That would be the topic for another
Und es ist
film.
ein kompletter Röntgenstatus aller Zähne und Lehrkieferpartien anzufertigen.
That's why I always ask for
Ist eine
a complete
Vitalitätsprüfung unerlässlich.
X-ray status of the patient, even though he might be totally edentulous.
In einer Sitzung dem Huneke-Test unterzogen werden müssen. Des Weiteren, dass davon abhängige Fernleiden nur 8 Stunden beschwerdefrei sein brauchen. Des Weiteren, dass der Huneke-Test auch bei Schuldhaftigkeit der Zähne nur in etwa 50% der Fälle positiv ausfällt. Und als letztes, dass eine erfolgreiche Therapie nur operativ erzielt werden kann. Das heißt, nur durch Entfernung aller devitalen Zähne und aller pathologischen Veränderungen.
Okay, when you talk about the oral cavity, you have to palpate, you have to see the oral cavity in professionally taken x-rays. Some of the pathologies do not show up in x-rays. You have to go in with your finger and palpate. You might find areas, edentulous areas, especially, that might hide in themselves residual osteitis problems, and those residual osteitis problems might be fields of disturbance that are very silent. They don't even show up in x-rays. They don't even cause any problems locally, but they might be nourishing and sustaining pathologic foci or conditions somewhere else in the body.
Des Huneke-Tests ist einfach. Es muss an jedem in Frage kommenden Zahn und jeder pathologisch veränderten Lehrkieferstelle, bukal und palatinal bzw. lingual, in der Wurzelspitzengegend mit der 20er Nadel jeweils 0,2 Milliliter injiziert werden.
This is just explaining how the Huneke test is done at the odontal level, buccally and lingually. You go at the apice level and you deposit a couple of drops of procaine. If the disturbance or the symptom that has brought the patient disappears, then you know that that specific odonton is responsible. Unfortunately, this unique test is only accurate in about 40 to 50% of the cases. There is another technique that they have come up now with, which is the ligamentary injection with the gun, with the intraligamentary gun, where you just glide along the tooth with a very fine needle and inject very slowly the protein so that it covers all the root structure. If you do it too strong, that holding apparatus is going to disappear and the tooth is gone. If you just flood this here with procaine, you will, during the time of the lasting of the anesthetizing effect, be able to see if the elimination of that tooth, because if it has been isolated with procaine, it has been isolated from the fish finger basic system. So during that time of isolation, if the pathologies, the symptoms disappear, you know that that tooth is the responsible or at least co-responsible agent.
Erstens zur Testung des Zahnkieferbereichs als Störfeldursache
Das
und
ist der normal
zweitens zur
Bunic test.
Nachbehandlung nach prudentogener Hirnsanierung. Wichtig ist noch die Kenntnis, dass eine Leitungsanästhesie zu Testzwecken nicht geeignet ist.
Bei der Neuralgie des dritten Trigeminusastes kann mitunter durch die Infiltration des Nervus mentalis ein Erfolg erzielt werden.
In neuralgias of the third branch of the trigeminal nerve, the one that has its exit point at the Mentonian nerve exit, just the injection onto that nerve might bring very good results. Some people say that the neuralgia of the third branch, that pain here, is even worse than the neuralgia of the first branch of the trigeminus.
Dieses Nerven ist das Foramen mentale, das an der Sagittalfläche des Unterkiefers zwischen dem ersten und zweiten Prämolaren angetroffen wird.
Normally, in anatomically well-formed structures, it's before, in between the first and the second premolars, the Mentonian foramen, where the third branch of the trigeminus comes out.
Und die Tatsache, dass sich dieses Foramen nach dorsokranial zu öffnet. Demzufolge geht man am Markierungspunkt mit der 20er Kanüle ein und setzt bei Knochenfühlung ein Depot. Nach Abtasten wendet man die Nadel und dringt von oben hinten nach vorne unten in die Öffnung ein und injiziert 2 Milliliter.
Bisweilen bekommen wir
With 2 cc, just trying to locate it, and if you press in the adequate place, it hurts because you're pressing the nerve against the bone structure where it is crawling out, you know. So if you press it against the bone, it hurts. Just depositing at the level of the foramen 1 to 2 cc and diffusing it might in many instances give you very satisfactory results in this trigeminal neuralgias of the third branch.
eine Irritation des Nervus laryngeus superior, für die keine klinischen Befunde erhebbar sind. Die Region seitlich des Kehlkopfes ist spontan und druckschmerzhaft und führt öfters zur Kanzerophobie.
The laryngeal nerve, the upper laryngeal nerve neuralgia, is the type of neuralgia that doesn't find any clinical answer from an orthodox point of view. It is a pain that is there. All the checkups are normal. It is a neuralgia of a tiny little nerve that is not reached through conventional means, and it leads in many instances to cancerophobia, because the patient ends up saying, my God, I went through all this treadmill of tests and whatsoever, and they don't find anything, and I still have that damn pain there. I must have a cancer. And then his downhill race starts from a mental point of view much faster.
Therapie besteht in einigen Infiltrationen an diesen Kehlkopfnerv.
Mit der 20er Kanüle wird 2 Querfinger seitlich vom Adamsapfel in leicht kranialer Richtung zum Cornumaeus des Zungenbeines
2 finger
eingegangen.
breaths on the side
Circa
of
2
the Adam's
Millimeter
apple,
liegt der Patient
cranially,
Schmerz an.
you find
Es
the
werden 2 bis 3
incision.
Milliliter injiziert.
You
Das
go in
gleiche
half
auf
a
der anderen
centimeter
Seite wiederholt.
and you deposit 1 to 2 cc and diffuse them.
Gebiet stellt die neuraltherapeutische Behandlung der Schilddrüse dar. Die breite Indikation reicht vom Basilumpf über die Hyper- und Hypothyreosen, den Tachykardien,
Another very important part of the cephalic treatment is the treatment of the thyroid gland. It goes all the way from the Basedov disease to regulatory disturbances, to menstrual disorders, to anemic conditions.
bis zu den klimakterischen Erscheinungen.
And climacteric
Bei den
conditions.
Wechselbeschwerden ist es vorteilhaft, die Injektion in die Schilddrüse mit der in den gynäkologischen Raum zu kombinieren.
That's why since we're talking about the glandular acts, the combination of thyroid is always good to be done in combination with the Frankenhäuser procedure, gynecological, or with the prostate if it's an patient. You see here
Reflexauslösung durch Injektion in die Trachea.
methylene blue, very little how the couple of drops that you inject into the thyroid gland, because you go through the capsule like you do it when you go into the prostate, you know, how it diffuses inside of the whole thyroid structure. And it is also like all of the injections in neurotherapy, since they have and they're looking for a regulatory normality, they are used in hypo and in hyper conditions. So, for example, the injection into the thyroid is for hypo and for hyperthyroidism. And now you understand it. Why? Because if we have a hypo condition of our cell that is not at minus 70 millivolt but at minus 40, the injection is going to hyperpolarize it to minus 240, and on the way back, once the effect of the anesthetizing agent is declining, it will stay at its normal level. That's for the one that is hypo. For the one that is hyper, it will hyper it even more, and then on the way back, it stays at the normoergic level. So it is a regulatory function that you comply with, and now that we've seen the game that is played in the Fishinger basic system, we understand why we don't need one type of injection for a hyperfunction, and we don't need one type of injection for the hypofunction. It is exactly the same injection.
Dann möchte ich noch darauf hinweisen, die Patienten gezielt nach Kopfnarben zu befragen. Laut Statistik betreffen 20% aller Traumen den Kopf. Die Patienten sind sich aber dieser Narben vielfach nicht bewusst, und damit könnte ein Erfolg aus der Hand gegeben werden.
The last thing he was recommending is that we have to ask the patient about possible scars in the skull. Most of the patients have scars in their skull, but since they happened when they were little kids and they were throwing stones at each other or whatever, they have forgotten about it. So you better start looking very thoroughly, because any scar in the body is a potential field of disturbance. I think that's it.
Okay. Let me have I hope you all appreciate what you saw here. Let me turn the sound down. Can you turn the sound down here? Okay. I hope you appreciate what you saw here. We I feel this is like a high-performance seminar. Last year when we gave this, we didn't have the videos to really see what was going on, and a lot of it we had all crowded around and he just demonstrated on a person. So your ability to get information that's useful to you is probably 50 or 100 times what it was last year for those people who were here. In fact, I think that what's developing here is a much, much better seminar than we had last year, and it's probably probably a better seminar than you've given in South America. Because I don't know whether you use these videos or not now. Did you? Well, then you only got it translated one way. Why don't we come back at 2 o'clock, and I want each and every one of you to think about where your head could benefit from some neural therapies, because we all want you to come up and experience it, and then if it's an easy injection, we'll have the doctors do each other for a little bit, and we'll do that right after we come back at 2 o'clock, okay?
And don't forget the scars in the skull that many people have forgotten.
Yeah. Well, Gary said his whole head is numb, doesn't make a difference.
Let's get it.
Thank you. Thank you for being here. 2 o'clock. Don't take my You already responded. I'm going like that.
We are going to get a couple of my
Here you go. She gave me some other stuff. I got that on. I think that's a penny cooker.
That's why I asked not burning, but